Hi, my name is Maeve. I'm a physiotherapist at NOCA, which is a pelvic health clinic in Canberra. This information is for men who need to learn how to use their pelvic floor muscles after prostate surgery, such as prostatectomy. The information presented is for general knowledge, and it is not a substitute for professional medical advice that is individualized to your care. So by now, you'll have received lots of information from your healthcare providers about the importance of doing pelvic floor exercises before your surgery and the benefits of doing pelvic floor exercises in preventing incontinence after surgery. So today we'll just review the reasons why this is important and run through how to do these exercises correctly. Remember, for you, you've never had to use your pelvic floor for continence in the past. Men prior to surgery have a prostate and urinary sphincters that play a very important role in their continence mechanism. And during surgery, when the prostate is removed, these will be damaged in some way. So part of learning how to use your pelvic floor is getting the skill correct to begin with, then training it to be able to work in lots of different situations. So today we're going to run through the best way to switch your pelvic floor on. For most men, we find that one of three cues works better. So they might be stop the flow of urine. So thinking about, can I switch on my pelvic floor by thinking about stopping the flow of urine? It could be lifting through the scrotum, or you might hear people say nuts to guts. So can you lift gently through the scrotum? Or shorten your penis, that idea of creating a change in length of the penis. Can you feel like you're shortening your penis? With all of those, it's very important that you do not squeeze your bum muscles, that you do not try and tense too much through your tummy muscles or hold your breath. And so it's often easiest to practice in lying because we don't have to stand up, we don't have to use those muscles. And so that's what we're going to do to start with today. So if we have a look at our patient here, our client here beside us, so they're lying comfortably on the bed. Knees are bent up and feet are flat. So some people find that holding their knees in this position is tiring. So they might like to be knock-kneed because then they don't have to support their legs at all. But whatever is most comfortable for you is fine. You're going to rest your hands lightly on your tummy. And then that's going to give us feedback about whether you're trying to use your tummy muscles to cheat and to try and help you switch your pelvic floor on. We're then going to practice and see which cue works best for you. So if you think, first of all, can you practice trying to stop the flow of urine? You might feel a small lift at your perineum, at that space between the scrotum and anus. You might feel nothing at all, but do a little small check-in and see, are you breathing? Can you keep your tummy relaxed? Can you keep your bum muscles relaxed? You're going to hold that for a second or two and then relax completely. The second cue that we're going to try is shorten the penis. So like you're drawing up through the penis. Same again, can you keep tummy muscles relaxed? Can you keep bum muscles relaxed? Hold for a second or two and then relax completely. And then the third one that we can practice is lifting through the scrotum or nuts to guts. So again, the same idea, lifting through the scrotum or nuts to guts, keeping tummy relaxed and keeping bum relaxed. And again, working out which feels best. Whichever you feel is the best cue for you, that you feel like, oh, I can actually feel a little bit of a lift and I don't want to use my tummy and I don't want to use my bum muscles, that's your cue. And that's the one you're going to practice in lots of different positions throughout the day. So to start with, you might try it in lying, but most men we know will leak when they're standing or when they're upright against gravity. So very quickly, when you feel confident in the cue that works for you, you're going to start to practice it in standing. So if you'd like to stand up for me, take your time. And again, in standing, we're going to do exactly the same thing. So you're going to have your weight even on both feet, hands on your tummy, making sure your bum is relaxed and pelvic floor is relaxed first. Then you're going to think about the cue that works for you, whatever that might be, stop the flow of urine or lift through the scrotum or nuts to guts. You'll hold for a second or two and relax completely. Once you feel really confident that you know what you're doing, you're going to practice in lots of different positions. If you still can't feel anything, this is sometimes when it's good at home to practice nude in front of a mirror, because you may see a little bit of a lift through your scrotum, or you can put your hand at your perineum and see, can you feel a lift? We're then going to practice using our pelvic floor in lots of different positions. So that could be when you cough, when you sneeze, when you laugh, or when you lift, when you go from sit to stand, and when you go to get out of a car. Some people need more practice using their pelvic floor because it's a brand new skill. And that's when we always encourage you to see a pelvic floor physiotherapist or seek more help, rather than just trying to do more and more and hoping that you'll get it in the end. Sometimes things can get quite sore and uncomfortable, and we don't want